The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Are you able to hear me? I hope so. It says, question, do we have a call in to hear the webinar? Do we need to call the number in order to hear you? Can we hear you? Yes. Yes. Okay, good. So, yes, you need to have your phone, and you need to use the call-in number and the access code to be able to actually hear the presentation. Is everyone able to see my screen, please? Okay, great. I need everyone to respond to that question so that I have a list of who is actually in attendance, please. Excellent, excellent. Now, if you have a question, please, there's a little hand that you can raise. Please raise your hand, and I'll be able to maybe unmute you or direct you to the question list, okay? All right, so the first thing I want to do is I want to say thank you for attending this session. I'm really excited to offer a test-taking strategies for all of our students, as this is something that is dear to my heart, because a lot of times students are not able to get the idea of how to take a test, especially when it's related to nursing testing. It's very, very different. I've actually been teaching with Grand Canyon University for about 5 years. I've assisted with Kaplan and Hesse NCLEX reviews, and I am currently a level 4 instructor, with which is 421, your Transition to Practice course. And my name is TJ Land, and I hope to see all of you in the very near future. Okay, so I'm going to go through the basics of test-taking strategies, but I'm focusing these on nursing questions and examinations. Okay? So the objectives are that you're going to be able to discover a few key things about you yourself and how you're going to become a better test taker. We're going to look at what the value is for you guys as a student when you consider basic study tips, and how you can do your work prior to the test that will be crucial to help you with your success. We're going to start developing an understanding of a basic test-taking strategy and even practice a few questions to see how it works, okay? In addition, as most of you are already aware, everybody gets test anxiety, and it is a huge factor in your ability to perform. So in this presentation, I hope that we're going to be able to assist you in ways that you can decrease your anxiety and become a better test taker. We are actually going to see many strategies that can be utilized, but again, I'm going to try to show you the ones that are basically for nursing. So these are your objectives. So what exactly are test-taking strategies? They are skills and approaches which are unrelated to the actual characteristics of a test, which is intended to measure which may increase the score of the student's test. Okay, so let me say that again. I might have stammered a little bit there. Test-taking strategies are skills and approaches which are unrelated to the actual characteristics of a test. It is intended to measure things, right? So measuring things actually can increase scores of student testing, but it also has to be recognized with coaching or even the experience of the person who is taking a test. Okay? So if you take a test-taking strategy, such as today's course, you're going to be able to possibly increase your ability to get better scores. okay? It also can give you the opportunity to maybe even start coaching some of your colleagues in study groups, things like that. So when I talk about coaching or experience, that means that we as the faculty can provide assistance to you guys as a student, and then maybe you guys can help those in your study groups. So why are we going to utilize test-taking strategies? Why do we even have an interest in that? So there's many reasons why we should give our students our knowledge regarding of how to take a test. If students succeed at testing, they will increase their academic performance and increase their engagement in the process of learning. This is an all-around win for the student and the faculty. Well, personally, I think that's a great idea. The success of students is actually the success of faculty and the nursing program. With increased scores on exams, this means we have increased pass rates of the NCLEX. This also can be reflected in students being retained and making a better score and being able to go through the entire program without fear or concern of having to re-enter the program. Okay? Now, our next one. So, student performance is a big deal. Student engagement. Well, we need to have you engaged. All right? Preparing for the board exams. Well, that's the whole shebang here. We give you the knowledge, we show you how to utilize it, and then you have to be engaged and actually take that exam to the best of your ability. So these test-taking strategies have actually been used preparing students. We've also been able to incorporate the QSEN, which is Quality Safety Education for Nurses website. Some of you already know about the nursing core competencies, the Nursing of the Future core competencies, and the knowledge, skills, and attitudes, or KSAs, are the kind of things that we're talking about to help QSEN and the Nurse of the Future core competencies and have our students be successful. All righty. So, how do they relate to those KSAs? Well, you as a student are going to utilize some strategies and actually use something called critical thinking to problem solve during a review in the area of, number one, patient-centered care, second, teamwork and collaboration, third, evidence-based practice, fourth, quality improvement, fifth, safety, and then sixth is informatics. Now, these are the QSEN competencies, but they are also included in the Nurse of the Future competencies. So those of you who are just starting out for test-taking strategies in the nursing program, please remember these. You will be hearing about them quite often. I am going to skip over some things pretty quickly. I don't want to bore you with some of this stuff. So for the student, there are different test environments. Now, there are some people who need extra time to read and make sure they understand the question for whatever reason. I want to make sure that you guys are aware that there is a student disability service, and it doesn't mean that you have a learning disability or anything else. It just means that they can accommodate shifts in your ability to take a test, the timing of taking a test, to sometimes allow people to read better or decrease testing anxiety. So if you have those issues and you really think it would be beneficial for you, I do encourage you to reach out to the SDS, Student Disability Services Department here at Grand Canyon. You can do these on campus, online, and please remember that we've actually all utilized these, our faculty, all of us, have utilized these test-taking strategies to help us improve our own ability to take tests. So when do we start? Well, you have to integrate test-taking strategies very early, which is why we decided to open this particular presentation open to any student of any level. The sooner it's introduced into the curriculum, the better it is. And that's like College 100 courses. Once we start getting into 2s and 3s and 4s, you're already used to taking tests, and I want to make sure that you actually look at the nursing way to take this test. Okay? And it's important that we discuss these strategies prior to your first exam so that you can actually use them and make a difference for yourself. So here are some study tips, okay? These are going to help you be successful. Class attendance is critical. This is where students receive vital information that you are going to need for success in the course. You need to read all of the assigned material to gain a full understanding of the concepts. Now, when I say read all the assigned material, you need to learn different ways to read material that you can read quickly and understand quickly. Now, those of you who love to read, it's not going to be a problem. Those of you who have issues with trying to read, or that's not your favorite thing, I do recommend that you seek your faculty members' assistance and some other strategies on how you can actually get through the content, the reading content, in an easier way for you in particular. And I know that they will be happy to help you with that. So while you're in the class, effective note-taking skills are very important. When you write important information down, this actually helps you retain the information for your testing. It's actually very equally necessary for students to ask questions, as this helps increase your ability to understand the material being presented. So anytime students have difficulty, it is greatly encouraged that you meet with your professor, and they can assist you in helping to devise a plan to help you succeed. We also have other services such as tutoring and remediation programs with Grand Canyon University for you to consider. We definitely do not want you to struggle too much. We want you to seek out that extra assistance earlier rather than later. We do provide one-on-one individual student learning. There's tutoring through the Learning Success Center for one-on-one tutoring that is free of charge. There's also these content clinics that are going to be helpful, offered throughout the semester for each of the courses. The other thing is, I highly recommend that you be in a study group. Either get into a study group that's effective, because it's a good way to study and share material being retained for test taking. One of the things I do want to suggest here, and I don't mean it to be mean, rude, or anything else, except when you join a study group, you actually want to make sure that the study group you are joining have a good grasp of the content, are making good scores. Because I have found that when students study together, they tend to make the same kind of grades. So if you're studying with a group that's struggling, you're going to continue to struggle. Okay? So study tips are kind of important, because you have to study and prepare to be able to be effective while in the classroom. So successful students learn technical vocabulary. How can you answer a question if you do not know what the vocabulary is utilized in the question? It's also important to understand material. If you are unaware of a specific term that is presented to you in the classroom, please, we encourage open discussion, and we would like for you to either look it up and share that with the rest of us when you're not familiar with that, or if you're not able to look at it, or you don't understand it, or you can't locate it, please don't hesitate to ask your professor, because if you have that question and you have that issue, others in the classroom may also have that issue. Some people like to use index cards to put the key points on the index cards and then put them in order. Some students are able to retain information when they see it, write it, and speak it. Doing all three. Remember that you want to review the information systematically and get a head start on trying to embed the information into your brain. I will tell you, cramming the night before the test is not, N-O-T, not a successful strategy. If you do not know it by the night before, you are going to struggle. And it's easier to get you going earlier than later. You are going to want to divide the material into small, logical sections where you're able to concentrate on just one piece of material at a time. Because if we give you too much information at one time, it actually all runs together, becomes too difficult to remember. So one of the things you want to make sure you're doing is you want to make sure that your time management is very clear, and that you're going to try to adhere to that in how do you prepare for the next lecture. What information do you need to know for the next lecture, and do it in advance so that you can ask appropriate questions while in the actual class. The average learner actually retains about 7 pieces of information at one time. The average time span for a person's concentration is only about 20 minutes. So make sure that while you're studying that you take breaks so that you're able to retain the information. But they are brief breaks so that you have energized and then go back and sit down and work at it again. Okay, practice, practice, practice. Answering questions. Practice makes perfect, and I know you've heard that before, but it really is true. Like med math, you guys actually have to practice your med math all the time so that you are very successful. And you're able to do one problem at a time, and then you get better and better, and you're able to then incorporate lots of different kinds of med math. Repetition is extremely important in your ability for absorbing information. Sometimes instructors will provide questions after each of their concepts that are being presented in the classroom. So make sure that you are working on those questions, and if you are having difficulty, please discuss that with the instructor so that hopefully they can assist you in locating where that difficulty is and can clarify that mistake and prevent it from happening again. So you all are to understand where, when, and what time is your exam. I will tell you the majority of nursing exams are done in a multiple choice or select all that apply fashion, with med math being a fill in the blank where you actually do the med math, show your work, and then provide the answer. What you need to bring is you need to bring pencils, erasers. We will actually provide you with the calculators that you will use during the examination. Water would be a good thing. Some people who need a little fidget thing, a little thing that they can play with in their hands. Some people use their pencils. But you need to do it quietly, because if you're a kinetic learner, that's something you need. If you are cramming the night before, then I am very concerned about the fact that you are not going to get the sleep that you need. So please get plenty of sleep the night before. Now, the next morning, you want to get up early, and you want to get up early enough that you're not rushing. Because if you start rushing and you rush through the entire process, you will continue to rush and feel behind, even if you're not, when you're in the classroom trying to take your test. You'll be too worried about, am I late? Am I going to be able to take the exam in enough time? That needs to be let go so that you can focus on what you do know and keep moving forward. Our brains actually have to have sugar or nourishment for brain synapses, neuronal synapses to occur. So for you to think clearly, you need sugar, be that carbohydrate sugar of candy or be it long-term protein. You need that. So you want to try to eat something, yes, light, but healthy. Maybe even bringing a snack to eat after the exam so that you can regenerate your brain, because you're going to be really tired after you have some of these exams that you take. I will tell you, caffeine, a lot of people want caffeine to get them going, keep them revved up, but I do know, because evidence has shown that caffeine actually decreases mental concentration. That's why I recommend water. Some people don't like water, but here in Arizona, it is highly recommended. And again, I will repeat, last-minute cramming is not an effective way to retain material. One of the biggest things that we all have to worry about is test anxiety. Test anxiety is a huge distractor. You actually need to work on effective anxiety reduction techniques to help you relax as much as possible when you are taking your exam. Relaxation responses to a technique or a procedure that it helps you become more relaxed. And we actually teach some of our patients some of these things, such as biofeedback, deep breathing, yoga, recentering your mind after hefty sections, lots of different things you can do. One of the biggest things that I do recommend is that you never say, I will never pass this test. Because as soon as you start saying negative aspects to yourselves, about yourselves, then it will undermine your ability and your confidence. I am not a good test taker. Well, you might not have been in the past, but if you start paying attention to what you're doing and some of the strategies that we're talking about today, you will be a good test taker because you will know the content. Knowing the content is how you become a good test taker. And if you know the content, you don't have to worry about not getting a good grade. Please remember that if it is either emotional or somatic fight or flight response, then you have to consider this is fear, and it's triggering your test anxiety. Fear. Remember, fight or flight, this is where we're going to fight somebody or we're going to run. Fear. And you need to try to do everything you can to make you more comfortable with the content and be able to effectively answer the questions. Okay? Again, deep breathing is one of the big techniques that I teach my class, and before each exam I have them do the 3 deep breaths, and then I tell them every single time you come to a hard question or you get ready to turn the page to another page of questions, you can stop and you can close your eyes and take 3 deep breaths again and recenter yourself and start over. And those deep breathing exercises or techniques have been very successful for them. So here is what I have recommended with a couple of different techniques to be included in this. I do encourage them to put both feet flat on the floor. You can grab underneath your chair with your hands where you push down with your feet and pull up with your chair at the same time for about 5 seconds. And what that does is that causes muscular relaxation. You tense it all up and then you actually relax. Some people, they're not able to do that, but that's okay. If you can, repeat that 2 or 3 times with a relaxation of 5 to 10 seconds between each time. All of your muscles are going to relax except for the brain, which is the one that actually has to take the test, and your hand, which is the muscle hand muscles that are the ones that are going to help you write on the test. Those of you who cannot do the grab and pull and push down, I do have people close their eyes, put their hands on their lap, feet flat on the floor, and imagine a safe and happy place for them, and then do the 3 deep breathing exercises with X seconds of rest in between. Give it a try. See if your muscles don't relax a little bit. Okay. So now, I hope you've been able to give that a try. Another way you can do a relaxation technique is called the palming method. And on your screen, you are actually able to see the instructions. So close and cover your eyes and use the palm of your hands to cover your eyes. Then, as I said, how I recommend for my students, think of some real or imaginary relaxing scene. Typically, I tell my students to think about someplace that is safe and they're happy and they like to be there. Okay, now visualize that scene for just a few moments. I don't know that you're going to have a full 1 or 2 minutes, but for as long as you can. And then you want to open your eyes and see how you feel, and then actually repeat that. Sometimes students actually have to have sounds or smells included into their imaginary or visionary relaxation scene. So if you are thinking about the beach, think about what it's like to smell the salt in the air, or hear the waves hitting the shore. Okay? Okay, so there are parts of a question that you need to know about. So there's a case or a scenario. This is actually the part where it describes the patient or the client and what is happening. The other piece is the stem, which is the part of the question that is actually asking you the question. Then you have the correct response, and then you have something called the distractors, which are the other incorrect responses, but they could potentially be feasible. There's always going to be like one word that will make it wrong. So be very careful when you're doing your test taking. So one of the first things I have my students do is I have them put the question into your own words. Okay? So if you have a long question, say to yourself, well, this question wants to know what? It wants to know what? Rewording it in your own words helps you understand what it is that it wants, and it will help you be able to make better understanding, comprehension, and then make a better decision. When you're able to do this rewording, you actually understand what the question is really asking. If you're not able to understand the question or know what it's asking, how are you going to be able to answer it correctly? Sorry, I have a little bit of overlap there. Keywords is what we're going to talk about right now. And keywords are very important in helping you to decide what the question is really asking you. So picking out words from the question helps to ensure accurate comprehension. Okay? Some of those key words that relate to the client or to the problem or to specific aspects of the problem would be vital, primary, next, most Important. That's used quite often. Immediate. That means now. Highest priority. Again, you will see that one frequently. Essential. Least. Most. Best. First. Initial and primary. Words that I do not care for are always, never. Those two, I don't like those words because they can be wrong, because sometimes it's not ever, always, or never. So here's what I want to know from you. So what is the time frame? In what aspect is the patient's care or setting of care? So would this be pre-hospitalization in the clinic, pre-operative, post-operative, a same-day surgery, the day of surgery? So make sure that you understand what time frame the question wants you to look at. It's very important to help you decide the correct answer if you know specifically when this is supposed to be occurring. Now, I like to do things by the process of elimination. By removing answers that you know are incorrect, you decrease your anxiety by 50%, because now you have a 50-50 chance of getting it right or wrong. Strategies for using in multiple choice questions to help you with this are the things that we're going to have you go through with me here. Now, first off, do not pick the answer that jumps out at you first. That's because it may or may not be correct, but it may be just correct enough to throw you off. And if there are other options below that one, read them. Another one might be more correct. So make sure that you are carefully reading and considering each of your choices before you make your right decision. Now, you need to eliminate the wrong answers to help you come to the correct answer. I like to say an easy way for my students is, okay, so for the example, we're going to look at this question. When doing a physical examination of a 17-year-old primogravida who is 30 weeks of gestation, a nurse should expect which finding related to mild preeclampsia. Now, those of you who are new at the lower levels, don't let all of this terrify you. But what I do want to do is reword this. This is a 17-year-old lady who's never had a baby. She is now 30 weeks pregnant, and we're worried about something called preeclampsia, which is very high blood pressure, water weight gain, retention, and swelling, causing lots of issues with mom and the baby. So I have reworded what that question is. And really and truly what it wants to know is, what signs and symptoms will you look for that will tell you the patient is having mild preeclampsia? So the first one, epigastric discomfort. No. Get rid of that, because that could be anything. Trace proteinuria. Okay, that could be a potential answer. So we'll put a question mark by that one. Dyspnea. Dyspnea is not usually a preeclampsia sign and symptom, so mark it out. So now we have number 1 and number 3 we have thrown away. We have a potential number 2. Number 4 says the blood pressure of 150 over 100. I'm sorry, but 150 over 100 is very high. That would not be mild preeclampsia. That would be prominent or definite preeclampsia. So the answer is number 2. You will have trace proteinuria. I'm hoping that that helps you guys understand that. So I want to stop right here and give you guys an opportunity to ask questions please raise your hand if you need to. I have Andrea Blodgett. I'm going to unmute you. Oh, it says you did not enter your PIN, so I cannot unmute you, but you can ask a question on the question page, and I will go there. Okay. Do we have to call in to hear the webinar? Yes. Andrea, is there another question? Yes, you do have to call in on the phone to the number before you can hear. Does anybody have any questions regarding how I went through that that particular question? Okay. So I will continue on. Did you see it actually jumped out from choice 4? 150 over 100. It jumped out and said, here I am. But it's actually the incorrect answer. So all the choices actually have or are signs and symptoms of preeclampsia. So all of them have the potential for being correct. But the question asks you specifically about mild preeclampsia. And those of you who have been through the family course, you know that choices 1, 3, and 4 actually are severe preeclampsia. And so the trace proteinuria is the correct response for mild preeclampsia. So did that help? I hope that helped. So something for you to consider is that you have to answer NCLEX type nursing questions, which NCLEX, for those of you who are in earlier levels, that is the State Board of Nursing examination that you must pass in order to become licensed. When you're answering those questions, we have to utilize the nursing process to help us determine what portion of the process the question is referring to. Okay, is it asking about the assessment, the diagnosis, the plan, implementation, intervention, or the evaluation and teaching our patient? And those of you in level 1, you are getting ready to learn all about the nursing assessment. We actually call it ADPI, assessment, diagnosis, plan, implement, and evaluate. So determine what part of the nursing process is actually the stem of the question. Then you can look at responses to see which responses match that nursing process. So if the question is asking about the nurse assessing, eliminate choices that do not relate to assessment. So if it's asking you about a nurse assessing, then the other things that are not assessing are not going to be the correct answer. One of the biggest things that you need to remember is you always have to have information, and you always want to ask more questions. So you must always assess before you act. Just like you have to stop at a stop sign and you have to look in all directions before you start to go, or somebody's going to have a car accident. The same thing with nursing. We must evaluate the situation. We must assess the patient, find out the information that we can, and then we can make a decision on how to act. So a question that regards or includes, again, assessments and implementations: is there enough information given for you to take action? If not, again, it goes back to you must assess first. So here's another question. Now, the night after an exploratory laparotomy, a patient who has a nasogastric tube attached to low suction reports nausea. A nurse should take which of the following actions first? Okay, so let's take this question apart. We want to POW it, put it in our own words. So I have a patient that is the first night of surgery in the belly. They went in and they looked around, so they cut his belly open. He actually has a tube in his nose that goes down into his stomach, and it's to suction to suck out all of his gastric acids, okay? He's now complaining of nausea, so that means he's sick at his stomach, all right? So you as a nurse would take which of the following actions first? The first question, again, we look for keywords. So you're going to take which of the following actions. So you are doing an action, okay? You also want to consider add tie. What part of the question of the nursing process is being considered? Action, eliminate the incorrect choices, okay? All right, so this is an action. You will be able to administer. Is that correct? Yes. Determine, yes. Instruct, yes. Assess, yes. All of those things are actions. Okay. So now we need to look at what should be the next thing that we should do first. So two of the choices require direct action and therefore are able to be implemented. So administering and assessing. No, sorry. Administering and instruction. These are the two things that you are actively actions, active actions, okay? The others are brain actions. Choice number 4, where you are going to assess the patient for pain, is actually something that you want to be tempted by. However, it says you're assessing the patient for pain, when in actuality, you're looking at nausea and sick at the stomach. So it can't be for pain. The 4 has to go away. And if you think further on to that, remember, we're talking about nausea, not pain. Okay? So you actually want to determine what is the patency of their tube, because that's the actual purpose of that tube. The tube in the nose purpose is to suction all that stuff out of the stomach so that the patient doesn't have nausea and vomiting. It's going to be very painful right after surgery, and we don't want them ripping that open, so we prevent vomiting. And that's why number 2 is the correct answer. Determine the patency. So now let's look at assessment versus implementation. In determining how to choose between assessments and implementation, which implementation is the doing part, you must decide if the question gives you enough information for you to take action, the actual do, implementation. You need to pick an assessment answer. If that's what the truth is, if you need to pick an assessment answer, do not pick an answer that involves an unnecessary assessment. Okay? So you make sure the assessment matches what the need is. So let's take another example. So we're going to try our strategies. Let's POW it. First, it says a nurse enters a client's room and the wastebasket is on fire. The nurse immediately assists the client out of the room. The next nursing action would be to what? So, in other words, we have gotten the patient to safety. Now, what do I need to do first? And we have to consider safety first. Keep that in mind. Key words. All right? So, action. Next action. Add pi, assessing. Well, when you're assessing, you actually saw that the patient needed to be moved, and you did that already. Okay? Now, would you, the very next thing, call for help, extinguish the fire, activate the alarm, or confine the fire by closing the room door? Which one of these actions will be the best, most effective next action? Calling for help. Well, what happens when you call for help and the fire is now raging? Well, we wasted some time. How can you extinguish the fire when you don't have anything to extinguish it with? Okay? Activate the fire alarm. Okay, that would be something we would do, but not next. You would actually close the room door, because they're fire doors, to help keep that fire in that room only. Then you would activate the fire alarm, and then find some kind of equipment, if you can, and extinguish the fire, if it's small enough to do so. One of the things a lot of people don't think about is, okay, so we're going to close the doors versus call the alarm. Well, yes, we can close the door. One of the things you want to remember is you are assisting your patient out of the room. So you are not at the room. On your way to the room, it's actually the fastest thing would be to activate or pull that alarm on the wall while you are returning to the room. Then you can close the doors and then consider fire extinguishment. So not only do we consider actions and what should be the next step based on safety, but also based on where are we? So if we assisted the patient out, were we at the room to be able to close the door? No, we'd have to go back to the room. Well, so let's don't delay calling the alarm because it takes time for the fire engine to get there. So pull the alarm on your way back and close the door. So I'm hoping that this has not been confusing, but a little more clear about how you make those decisions. And that's called prioritizing or prioritization. Words that say most, first, best, and initial are key words that you will see in a question. This means that you have to establish priorities and that you have to pick the answer that has the highest priority, the very first, okay? So how do you make those priorities? Those of you in the beginning levels, you're going to be learning about Maslow's hierarchy of needs. The very bottom of the pyramid says that people have to have physiological needs met, like food, water, shelter, and warmth. Those are the base needs that have to be met. Once those are met, then you can move up into safety, concerning security, stability, freedom from fear. Okay? So you have to consider the Maslow's hierarchy of needs when you start looking at priorities of questions. So again, Maslow's hierarchy dictates the priorities of care when you are doing patient care. Again, the lower levels must be met prior to addressing any higher level needs. And again, physiological needs always comes before psychosocial. You have to be physically safe before we can worry about keeping you mentally safe. Okay? Something else I need you to consider is that pain is a psychosocial need. All right? That is, unless it is extreme, like with a kidney stone. Kidney stones are really extreme. Otherwise, the other piece would be if it interferes with the ability for you to render them care, such as changing dressings or something like that, where it will be a painful procedure and you want to pre-medicate to keep their pain down. That actually makes that a physical need, okay? All right, looking at Maslow's hierarchy of needs here, we want to look at safety and security, which actually involves emotional needs. So essential to the recovery of a mastectomy patient, there is the need to discuss their loss of body part, which is their visualization, self-visualization of their own body image, okay, body image. So you have to remember that you need to effectively go through the grieving process before a patient can actually communicate their loss. So they have to be able to talk about this to actually be able to start the grieving process. And the grieving process is actually a fairly lengthy piece. A lot of women, this is a huge component of who they are, a part of who they are. And if you're taking part of them away, what does that do to them? A lot of them are concerned about their body image. Will my husband still want to, be with me? I will no longer be a woman. Is that so? Those are the things you have to help patients work through. And so when you have something like that, you have to use Maslow's hierarchy and regard human needs when you are making decisions. Okay? So, first of all, think safety. It is a huge factor in nursing, in all state boards of nursing, and all NCLEX examinations. Providing safety is a primary concern for all nurses. If there is a physiological need where some choices and social needs in others, please eliminate the psychosocial answer and do the physiological first. After that, you keep Maslow's second rung of safety in mind. That should be the very next choice. Okay, so let's do another question. So I have a nurse who is performing an admission assessment on a patient scheduled for a possible gallbladder surgery. The patient is scheduled for the next day for an exam, an oral X-ray of the gallbladder. But that's what an oral cholecystography is. Sorry. So which of the following would be most important for the nurse to include in the initial assessment? Okay, we've got a couple of key words here we're going to have to pay attention to. So you are actually admitting a patient, and this is your very first assessment, and they may have to have surgery, but for tomorrow morning, they want to do a procedure to evaluate the need for surgery. The actual question that you need to answer is, what would be the most important for you, the nurse, to include in this initial admission assessment? Okay, so now let's go through all four answers to this question. Remember that the cholecystography is a visualization through X-ray with contrast, okay? Now, the first one, you want to include asking them about any allergies the patient may have. Well, is that important? Yes. How about number two, the specific location of any pain? Is that important? Yes. Number three, family history of gallbladder disease. Is that important? Yes. And then review of any medication the patient has been taking. And yes, that's important. So here's the issue. All four of these are important. So what I need to know now is to prioritize what would be the most important. So out of these four, safety-wise, which one of these would be the most important? So since these are all assessments, and they should all be in the initial interview, the most important regarding initial assessment, because of safety, is all about allergies. All about allergies. So I'm hoping that helps you understand how that is working. Okay. I'm not real comfortable with this SAN shortcut, but I will tell you, I do tell my students, do the priority, do Maslow's hierarchy, and you have to look at ABCs and then the nursing process. You need to always follow that pathway when you are trying to answer priority questions. Okay? One of the things you also have to consider is Erickson's stages of psychosocial development, because that has to play into safety. The younger they are, then it's a big part of safety. So, when an age is given in the question, you need to try to align the psychosocial crisis with the actual response in your options. This will help you to determine how the patient's development is tied into what response you need to choose. For instance, a toddler dealing with issues related to trust versus mistrust. You would then need to keep in mind that when picking the correct response to the question, that they can trust or mistrust depending on what action happens. Okay? All right. So, prioritize the question, and then you need to look at Maslow's hierarchy of needs, and then safety. After that, we're looking at ABCs, airway, breathing, circulation. Airway, breathing, circulation. Airway means, do they have a patent airway? So if they have breathing, but they have a closing airway and they're starting to make stridor, then that's a problem with their airway. You cannot go forward to breathing until you fix their airway, because it's not going to be any good in just a little bit. Once you know their airway is okay, then you assess their ability to breathe. Are they breathing normal? Are they not breathing normal? Are they breathing at all? If they are, you can move to the next one. If they're not, you must stop there and do something about it. So meeting somebody outside, you will do breathing. Meeting somebody in the hospital, you will do an ambu back. Okay? Then you go to circulation. Do they have a pulse? If they don't, CPR. If they do, now we have to go look at something else. Okay? So these functions are actually vital to life, to the survivability of the person for life. Just because an answer choice says airway in there, we know breathing is most important to sustaining life, but if that is not open, then it's not going to be breathing next, okay? We must relate the question to an appropriate response, and always remember that the answer is not always airway. You have to work through those things, okay? So if somebody already has a breathing tube in place, an intertracheal tube, airway is not the problem. You have an established, secure airway already, okay? All right. So airway, breathing, and circulation are, again, essential to life. And Maslow's list, excretion pushes things out at the level 1, physiological needs. It's also important to note that this is a physical issue if the patient cannot breathe, okay? This is a physical issue. Ready, next one. A patient who is 1 day post-op after a gallbladder surgery. This could be the patient we had just a little while ago. He is reporting pain at his surgery site. Before giving a narcotic analgesic medication, in other words, pain medication, to the patient, it is essential, keyword, essential, for you, the nurse, to take which of the following actions. So when we reword this, when we POW this, the patient has had his belly cut open. Okay? He says he's having pain where he got cut open. Before I give him pain medicine, I need to do what? What is essential, the most important? What is the top priority? Okay? Number one, measure the drainage from the patient's T-tube. T-tube is a drainage tube specifically for the gallbladder. Okay? So would we empty the drainage? Would we measure it? Number two, would we record the patient's report of pain on the chart? Okay, would that be essential for you to take before giving them the narcotic? Number three says, take their pulse rate, respiratory rate, and blood pressure. In other words, take their vital signs. Will we want to know what their vital signs are? Well, let's see. Number four, determine if the patient has voided. Okay, so here's how I'm going to go through the way I look at some of these questions as yes, no, maybe. Okay? So, before giving a narcotic medication, one thing that some of you may not know if you're not far enough along in the program is that narcotic analgesic medications can decrease respiratory rate. So we have to watch for too much medication stopping them from breathing. Now, what does measuring their drainage have to do with giving them something for pain? Nothing. Throw it out. Second one, record the patient's report on the chart. Well, I will do that after I give them the pain medication so that I can also chart what I did about it. Okay? I don't think we should do that one. Number three, take the patient's vital signs. Well, respiratory rate is something I'm worried about with analgesics, and yes, it would be something I would do specifically for analgesics. So I like number three. Number four, what has urinating or going to the bathroom had to do with giving him something for pain? Nothing. So 1 and 4 I have thrown out. Number 2, yes, but it's not the first thing. It's not essential. Number 3 is essential. We must know what his respiratory rate is, what his pulse rate, and what his blood pressure is before we give the medicine so that if there's any issues, we can assess him again and know what his baseline should be. You need to take their vital signs. So remember, all of the choices that we had were actually assessments. I want to actually go back for just a moment so you can see this question. So if we remember Maslow's first, we have to examine the physiological need, okay? Pain is actually a psychological need unless it's extreme or to the point of physiological problems. If the patient's other needs are met, the nurse would take action to try to alleviate the pain, okay? So he's in a hospital, he is safe, he's airway, breathing, circulation, all that is okay. So now what we do need to address is the pain, okay? Okay, there is a type of question out there. Okay, those were all called multiple choice questions. There is a multiple choice question out there that's actually called a select all that apply. These are very difficult questions because you have to pick all of the correct answers for you to get this correct. You have to treat each answer as if it was a true or false answer, and this technique will really help you. If your statement is false, then do not pick it, okay? Repeated words. Words from the question are often repeated in the answer, so that's something for you to consider, especially with select alls that are reply. Frequently, the same word or even a synonym will be in both that question or the answer. So please notice if something says something in the answer and it's in the question, maybe that could be the right answer. Okay? Maybe. The other aspect is opposites. So opposites is when we have two answers and they are actually opposite each other, such as a high blood pressure and a low blood pressure, or an increase in the IV rate or a stopping of the IV rate, or maybe even turning a patient on the right side versus the left side. The answer is actually one of those two. If those are on there, it is one of those two. So we're actually hoping as faculty that you are going to pick the correct choice. Seeing these variables in an answer can help you with that process of elimination of the incorrect response. Okay? So if it's the same answer, if two or three answers are the same thing, in the different words, none can be correct. Okay? If they say the same thing but say it in different words, they cannot be correct. Okay? Because that would mean all three of those would be right. That would make it not the right answer. If the answers are all too alike, then they're not correct. So be very cautious of the responses that are saying the same thing in different ways or different words. Okay? All right, umbrella answers. With umbrella answers, please remember it is all about picking the best choice as the answer for the question. And an umbrella answer is one answer that includes all the other answers. So there may be more than one correct answer, but one answer is better than all of the others because it includes all of them. This is also known as a global option or comprehensive option. Okay? The others will have, when you take vital signs, you're looking at respiratory rate, heart rate, you're looking at blood pressure, and you're looking at saturations, temperature. So a global or comprehensive answer would have all five of those. But one answer might have 4 of the 5. Another one might have 2 of the 5. That makes them wrong. Even though they're the right answers, it's not fully inclusive. That makes them wrong. Okay? So let's try one of those. So I have a nurse from the emergency room who received a telephone call from an EMT, and she is told that several victims from a plane crash who are survivors are suffering from cold exposure and they are being transported to the hospital. The initial nursing action of the ER nurse would be which of the following. So when I reword this, I kind of do it as I go. So you as the nurse, you get a phone call from the ambulance saying they have several victims of a plane crash who are suffering from cold exposure en route to you. What would be your very first action? And you have to pick which one of these are the proper choice. Now, I'm giving you examples of an umbrella answers, so keep that in mind, okay? So the first one says, supply the trauma room with bottles of sterile water and normal saline. Well, those are always put into trauma room as supply. Okay, so that's a yes answer. Number 2, call the laundry department, ask the department to send up as many warm blankets as possible to the emergency room. Okay, so that's it. We do that too for our traumas. So that would be an answer. Number 3 says call the nursing supervisor to activate the agency disaster plan. And then the last one says call the intensive care unit to request that nurses be sent to the emergency room. What some of you may not know is that the nursing supervisor's agency disaster plan actually includes 1, 2, and 4. Number 1 is correct, but it is not the one best answer that it will include all of them. Number 2 is correct, but it is not the one best answer to include all of them. So I'm hoping that that example has cleared up what comprehensive or global answers or umbrella answers are. So again, you need them to call the nursing supervisor to activate the disaster plan, because in the disaster plan, all of the options are then activated automatically. You don't have to specifically call and make it happen. Okay, another type is that we have an odd answer wins. Okay, that's like, if you remember Sesame Street, there's something that says 3 of these things belong together. 1 of these things is not the same. Okay, 1 of these things is different from the other 3. So the odd answer will be the correct answer to pick. That's the same principle for the odd answer win question. Okay? It may be the longest or the shortest. Could be the just simply very different in what it says, or the style of the answer. Okay? Absolutes. Each patient and each experience is different. There is usually a variable which is involved, so using absolute terminology is not an effective response. And these are terminology, like I already told you, every, always, these are absolutes. Answers that contain these universal absolute words are very apt or generally wrong. There are very little things in our life or in nursing that will always be correct or always be incorrect. Answers stated in absolute terms have to be looked at and read and considered with great caution. Okay? Here are a list of the absolutes. All, every, total, nothing, always, each, only, any, nobody, never, and none. So if you see any of these words in the actual question response, your little antenna or your little red flag should pop up. Okay? So here's a little checklist. This is kind of how we go through an exam with a student after the exam has been taken, and we evaluate or analyze why the question was missed. And you can actually go through this yourself. Did you carefully read the question or the stem? Did you read it carefully? Did you read every single answer option? Did you read the stem again in your own words? Did you look for those keywords? And did you do that process of elimination of anything or that would be obviously an incorrect answer? Okay? So again, we're going to review. These are your key strategies. How, keywords, ADPI, Maslow's hierarchy, FAN. You have to remember Erickson's development, ABCs, and then elimination. You need to prepare yourself with the ability to utilize these techniques. But you have to also prepare to study appropriately. We need to reduce your anxiety. You need to follow up with any remediation plans. So that means if you get something wrong, or if you have an issue with an exam where it's an unacceptable grade within here at Grand Canyon, it's 76%, you must see your instructor. Less than 80, it is strongly preferred that you meet with your instructor. Okay? So how can we fix this for you? What is the action plan to make it better? That's a remediation plan. feedback must be consistent. So if you start getting confusing information and confusing recommendations from your instructor, ask them to please clarify. Well, you told me to do this, and now you're saying this. Have them clarify that for you. Please remember to prepare for your examination by learning and utilizing the effective test-taking strategies that we discussed, okay? Again, I'm going to open this up for any questions so that if there are any, please don't hesitate to put your hand up or I'm going to see about our audio here. I'm talking. Let's see what I can do about everybody else. I cannot unmute you guys, so it will have to be you put a hand up or you type something into the chat. I am not seeing any other questions. Okay, I am being informed that time is up. I hope this has been beneficial. Again, this has been a test-taking strategies content clinic for all level of students presented by the Level 4 421 faculty, which it was offered for 421 level on their calendar. And please do not hesitate to request information from your own faculty. Thank you. Goodbye.